Aging starts ever since your 20s, right? So aging primarily is a concern in women, men, anybody over the age of 30. So what happens? We hollow out. We lose our fullness in the cheeks. The cheek starts to fall. Those are called the apple of our face, and it starts to jowl in the lower face here. So the apple of your eye has moved from your cheek down to the chin. So now that starts the hollowing process. The temples hollow out, the jaw. And so how do we address all these hollow, thin faces as we get older? First of all, marathon runners have a lot more hollowing, a lot more volume loss. Why? Because they lose fat and they lose collagen and sometimes a little bit of that bone mass. Bone mass is lost, muscle mass is lost, fat is lost. Obviously, after your 40s and 50s, even more. And we lose that at a more progressive, steady state as we get older. So when you look at the skull of somebody in their 30s and somebody in their 70s, the skull, actually, the bone shrinks. So everything around it starts to sag. We don't have the bone structure to hold it all up. So now we're saying, how do we fix it? How do we look our best at our age? How do we look healthier? So we use something called fillers. We talked about Botox in the past. Botox relaxes the muscles. Fillers actually give our volume, restore the fullness. It's like a pillow that has lost its fullness, right? Its support. It's now flat, so we have to plump up that pillow. And what do we use to plump up our faces? We use, first of all, something called Sculptra to volumize the whole face. That's a slow process. But there are products like Restylane or Juvederm, and in my practice I prefer Juvederm because I think it's a better product in many different ways. And how do we do that? Hyaluronic acid is found in our fillers. What is hyaluronic acid? Hyaluronic acid is part of your normal skin. What does it do? It absorbs 1,000 times its weight in water. So as we put this gel-like material into your jowl here, or your cheeks, or into the chin, even into the hollows around the eyes, we produce something called volumization. The product absorbs water and gives you fullness. Now, Juvederm has many different types of products. You've got Voluma, we use around the cheeks. It's a bigger molecule. We use Juvederm Ultra for cheeks down here, the nasolabials. We use Volbella and Velour around the lips. That's a softer product. You want your lips to be soft and full, not firm and hard. All right, so we use different Juvederm products. How long do these products work? They work for up to 2 years, depending on which product you are going to use in the Juvederm family. So Voluma can last up to 2 to 2.5 years. The other products will last up to a year, sometimes a little longer. If you have any kind of infections or any autoimmune diseases, we won't use any of the fillers, especially in autoimmune diseases. Lupus, rheumatoid arthritis, psoriasis, anything with an itis or dermatitis, you will have a reaction if you use any kind of fillers. So we will not address you as a filler patient. The products can last up to, as we said, 2 years, maybe even 3. Side effects when we do inject these, a little bit of bleeding, maybe sometimes a little bruising because there are little needles we use. There may be some inflammation, irritation, but that's the main problem. And results are seen immediately. You walk out, you see results immediately, whether it's the cheeks, the lips, the jowls, fill fantastically. Sculptra, which is the other product we use to volumize the whole face, that will take up to 6 months to see results. But results are quick, fast, and effective, as long as you're a qualified candidate without any underlying issues with autoimmune diseases or infections. So it volumizes the face, restores the volume, and over time, you also will leave some of your own collagen. So we stimulate your own collagen with hyaluronic acid, as well as giving you the immediate fill. So come and see us at Trillium Creek Dermatology and Surgery. It is not easy to do very, very good fillers. You have to know the anatomy. You have to know the blood supply. You have to ask the right questions. And with those background questions and knowledge, you'll get the best results long term. Thank you.